Hello, everyone. Today we'll be talking about the MNT toolkit in the breast cancer. I'm Christina.
I'm glad. So for breast cancer, it's an uncontrollable growth of cancerous cells in the breast tissue. This disease is the most common cancer among female patients or female cancer patients. 99% of patients are females over 40, 13% for chance for a woman to get the disease in her life. And it is in every country, but it is the highest in the United States. For etiology, it's different than the risk factors that we will be going over, but as far as the mechanism of the etiology is DNA alteration and damage from genetic mutations supplied by exposure to estrogen. So the more estrogen exposure, the more likely. And then the two genes are BRCA1 and BRCA2 that are responsible for carrying the likelihood of genetic breast cancer. The pathophysiology of breast cancer can be very simplified if you understand the anatomy of the breast. Breast cancer originates around the milk ducts. The genetic mutations that account for damaged DNA from immunosuppression include the high penetrance genes that I discussed and the low penetrance genes, which are the FGFR2 and TNRC9. The mutations deactivate the tumor suppressor genes in the milk ducts and loss of control of apoptosis, so the abnormal cells are increasing, and activate oncogenes to promote the growth of the tumor through the proliferation of cancer cells in the epithelium of the breast. Signs and symptoms of breast cancer early on include discharge, any lumps in or around your breast or armpit, a rash on the skin, or changes in the position of the nipple. These symptoms occur from blood and lymph vessels being blocked by cancerous masses that will affect your thyroid. For diagnosis, the biopsy that you would get after seeing signs and symptoms can confirm presence of cancer cells. To create the diagnosis, they're categorized into different stages based on metastasis level, and the location determining in situ or invasive based on relation to the milk ducts, either being contained within or spreading out. The prognosis or survival rate of breast cancer varies according to the disease stages, with 0 to 1 being 100% survival rate for 5 years, and 2 to 3 has 5-year survival rate of 72% to 93%. And lastly, in stage 4 being the most severe case, only 22% will survive the next 5 years. Common medical treatments include different surgeries to remove the cancer, chemotherapy to stop and destroy the cancer, radiation therapy, and hormone therapy to block estrogen receptors. Some common medications to treat breast cancer include these listed here like fulvestrant, Ibrance, disodium, Verzenio, pamidronate. These mostly target the estrogen receptors to limit estrogen exposure.
Okay, our patient is Dolores, she is a 53 years old female with a stage 2A breast cancer. The stage 2A breast cancer they appeared in two forms, either a tumor smaller size in 2 centimeter or smaller, with cancer spread to the lymph node, axillary lymph node from 1 to 3, or the other one will be 2 to 5 centimeter in breast without spread to axillary lymph node. She came with symptoms of lump in left breast, swelling and redness in the breast, bone pain and fatigue. She diagnosed since January 28, 2022. She's married to husband Maurice with 3 sons. retired, but she's working as a grocery store in clerk. She did a mammogram, breast biopsy, CT scan, and lab test. The mammogram revealed a tumor size of 1.5 centimeter with 3 axillary lymph node enlargement. The breast biopsy confirmed the diagnosis of breast cancer, and the CT scan revealed no bone or organ metastasis.
Lab results showed her hemoglobin of 9 grams per, and then glucose is 120 milligrams. Anthropometrics include her weight of 120 pounds. She's 5'5", and her usual body weight is 145 pounds. The surgery was a breast conservative surgery, removal of the cancerous lymph node. The medications she's currently on is a multi-drug regimen of regimens for dose every month. The nutrition symptoms include nausea, vomiting, abdominal pain, not feeling to eat, and taste changes, so low appetite relating to possible malnutrition that we will discuss further. Going into the nutrition care process, start off with ADIME in relation to our case study. For assessment, specifically for breast cancer, patients are always recommended a nutrition assessment in the beginning of their admission. And for breast cancer patients specifically, they use the cholesterol modified prognosis nutritional intake to assess nutritional status, but also the survival of the patient can be shown through this test with its results. It's been shown to be the most accurate and can catch malnutrition early. So for Dolores, her ideal body weight is 125 pounds, which she is 96% of her ideal body weight, which is still good. So we can catch early malnutrition. Her BMI is 19.97, which is also desirable. And then in NFPE findings, we found that her temporal and orbital was a little bit depleted with fat tissue, and the teeth enamel, modeling, bleeding gums, loose and wrinkled skin, and protruding clavicle bones that she never experienced before.
For the nutrition diagnosis, we found the PES statement for her, the weight loss related to change in food taste, which is due to chemotherapy as evidenced by the low BMI. Inadequate energy intake related to excessive nausea and vomiting from the chemotherapy as evidenced also by weight loss. For the nutrition intervention, there is several lifestyle modification for breast cancer patients will be adopted as recommended by the World Cancer Research Fund and American Institute for Cancer Research. The lifestyle modification will maintain an average body weight, engaging in physical activity, consuming a diet high in fiber and soya food, and reduce fat intake. Additionally, during the chemotherapy, we will ensure that she consumes enough nutrient and calorie to improve her health. The intervention would include nutrition education and counseling. Nutrition education for the patient and the family about healthy lifestyle with a focus on the importance of a balanced diet and a culturally accepted meal planning. Nutrition education about the proper hand washing before cooking and cook all meat to the proper temperature. For the beef, it is recommended to be between 145 to 160 degree. The poultry will be 165 degree and the seafood to 145 degree. And to avoid any raw or uncooked meat and processed food, use separate cutting board for meat and vegetable. Also, we recommend the Mediterranean diet, which has been found to be benefit for breast cancer. Some of the examples for the Mediterranean diet is use extra virgin olive oil as a primary source of fat in her diet with a minimum of 3 to 4 tablespoons per day. Include vegetable with every meal, such as green leafy vegetable, onions, garlic, and tomato. Consume at least 2 legume-based meals each week. Eat at least 3 servings of fish or shelled fish every week. Consume fresh fruit daily. Incorporate nuts or dried fruit into her daily snacks. Include whole grain bread, cereal, or pasta with meals and encourage her consumption. Also, the nutrition counseling, which is a collaborative process involving the patient and nutritionist to identify any dietary issue surrounding the hair and seek appropriate solution and advise her. We will counseling here about the change of taste, which happen due to damage of taste receptor on the tongue or digestive issue associated with the chemotherapy. And encourage her to increase her food intake by adding some flavor to the food, consume smaller meals more frequently, and drinking sweetened beverage with meal. Also, we'll encourage the healthy eating habit, as we said before, to consume high amount of fruit and vegetable. The energy requirement for her, we measure it at 35 kilocalorie per kilogram and multiply it by factor 1.3 as she's malnourished. So she has to consume around 2,476 kilocalorie per day. As a protein requirement for her, it is 2.5 gram per kilogram. As we mentioned, she's malnourished and she's taking chemotherapy. So it will be 136 gram per day. For the nutrition supplement, we will recommend the zinc supplement, as the chemotherapy agent usually chelates zinc. So the zinc supplementation will be beneficial for her. Also, vitamins D supplementation are recommended, as vitamin D has shown in some research having anti-proliferative and anti-inflammatory properties. It also involved in apoptosis and cell differentiation. Multivitamins, especially vitamin A, B, C, are beneficial for her, as she's malnourished due to the complication of the chemotherapy, as well as the nausea and vomiting with chemotherapy. For the nutrition monitoring and evaluation, we will requesting from her a 3-day food log, including a weekend day. The weekend day, we will include it to understand the patient dietary habits precisely and to track adherence to the recommended diet. Also, during each visit, we will employ a food questionnaire containing a food group to make sure that she's adhering to the healthy diet. We will do a weight measurement each visit. In the beginning, it will be weekly till we make sure that she's gaining weight, and then we will transition to a monthly visit. In conclusion, the breast cancer is a significant issue with multiple contributing factors to its incidence. Dietary change can impact the risk of developing cancer, recurrence rate, and the overall health of patients diagnosed with breast cancer. In recent years, numerous studies have focused on nutritional support for breast cancer patients. However, there is a lack of research on the association between main food group and the breast cancer risk and the role of specific nutrient in increasing breast cancer risk. Future research should broaden its scope to study the effect of each food group on the risk and recurrence of breast cancer. Additionally, nutrition intervention should be promoted to help patients to adjust their lifestyle during treatment and enhance their immunity. This is the reference we used if you want to see it. Thank you, everyone. If you have any question, please post it in the discussion and we will get back to you so soon.
Thank you.
Sharing.